So now, once again, now that we've started the IV, we're going to go ahead and administer a medication through our IV site. So in this video, we're going to show you how we administer D50, dextrose, right, 50%. So our patients with hypoglycemia, we would need to start our IV and push D50. Some important things to note about D50, make sure that we're using a large catheter, large line. We're going to have to bolus a lot of fluid to help kind of dilute it down. And we want to make sure that we have a patent line. We want to make sure that the line isn't going to blow. D50 is very necrotic to tissue, so if we infiltrate, we can cause a lot of problems for our patient. All right, so as we once again grab our medication, right, we have to be able to pull it out of kind of a list of medications here. So I see I have 50% dextrose. I look at the expiration date, make sure it's not expired, and that I have the correct concentration. This is 0.5 grams per milliliter. Okay, I'm going to go ahead and open up my medication, and I'm going to assemble my syringe. So this one's a pretty easy one. I take the handle, and it's going to screw into the back of the syringe, and then I'm going to go ahead and make sure that I get rid of all of my air out of the line. All right, now that I've prepared the syringe, on the syringe itself, I want to make sure, once again, 50% dextrose, make sure it's not expired, and make sure that it's the correct concentration. So everything I need is kind of right here in the lot, an expiration date, 50% dextrose. So this is the correct medication that I want to administer. All right, so when performing the procedure, I'm going to go ahead and take my alcohol prep pad. We're going to clean the site. While I clean the site, I want to make sure that I ask my patient if they have any allergies, or from family if my patient's unresponsive. See if they have any allergies or sensitivity to the medication that we're going to be administering. Okay, once we've done that, I've now cleaned my site. I reaffirm my medication, making sure that it's 50% dextrose, and we're going to go ahead and attach it to my medication port. Alright, with D50, I know on the sheets it'll say to close it off. D50, you'll see it administered a couple of ways. One way is to open it wide open, and with a lot of the new lines there's check valves. So I can go ahead and slow push my D50. Right, based on my protocols, it may be anywhere from 25 grams, which would be the full dose, or 12.5 grams, which is half of the dose. So as I'm administering it, once again, wide open line, I'm going ahead and doing a slow push, allowing the medication to get into the patient. The fluid is diluting it down so that it's not so thick. So for this scenario, we'll let you know that per my protocol, I'm going to go ahead and administer 12.5 grams, which is 25 milliliters. Should take me about 15 to 30 seconds. All right, making sure that my fluid isn't backing up in my line. Almost at 25 milliliters. Alright, so I've now hit 25 milliliters, which is 12.5 grams of D50. I can go ahead and remove this. And then I'm going to go ahead and leave this line open for 30 seconds to allow that to flush. And then I'm going to reassess my patient. Right? In this case, I'm going to recheck a blood sugar. Hopefully my patient is starting to come around, and we're just going to continue to monitor that patient. If I need to give another dose, we can administer another dose based on our protocols. All right, once again, if you have any questions, we'll be talking about this in class, so bring any questions with you.